economics editor at the Australian newspaper. He's a hard man to catch, I tell you what. Every couple of days, mate, can you come on the show? Sorry, I'm already booked. Can you come on? But he's the busiest man in the business, but thankfully he has carved out some time for little old me. How are you, great man? Lovely to see you again. Your fearlessness through this time of groupthink has been amazing. Well done.
Thanks very much, Paul. It's good to be on the show. I'm sorry I can't be in the studio there with you. I'm just in the spare room.
Now, you've written some great stuff, and there's so much to pull apart of what you've written in the past little while. But let's talk specifically here about one of the pieces that you wrote this week was something that has been absolutely exposed is the Doomsday modelling, which led to the 150,000 people will die in Australia. Now, again, there was this smoke that was coming towards us and nobody could quite know. But now that we're able to have a little bit of a pause, a coroner's investigation to look back, tell us about the types of bad information that went into predictions that meant shut everything down.
Well, look, the worst of all, Paul, was back in March by Imperial College. That's the famous Neil Ferguson model, which prompted the UK government to shut down very severely, and also the US as well, I would say. And that was massively wrong. It was a huge overreaction. It forecast millions and millions of deaths, and it wasn't just in the UK. There were similar models in Japan, in Sweden, and of course our own Doherty Institute in Melbourne. Famously now, I think, said that if even with a huge shutdown and extremely severe social distancing, we'd still need 5,000 ICU beds. And of course, in the end, we only needed 100. So, it's a good thing, of course. It's a great thing that the virus has not been as lethal as we first thought. But the economic damage, which, the IMF only just this week ratcheted up from $9 trillion US to 12 trillion, that's just over the next 2 years, is just enormous. And it's, it's going to be with us for many, many decades, this economic cost. And I think, as I've argued, I think for months now, I think the lockdowns are, in the long run, probably going to be worse than the disease itself in terms of their economic impact. Well, especially on
and this is a point that you were making today, which was that the people who are hurting the most out of this and have the worst potential to be hurt out of this and the worst reality is the poor. I mean, so, essentially, a lot of these people who love the idea of the lockdown are the upper middle class, but exactly. The working class got smashed.
No, look, that is exactly right. It's been very, very stark, I find, very obvious that the cheerleaders on social media and so forth, for the very hard lockdowns are almost to a T. Working in the public sector or at least living off the public sector in some way. And that's of course, cynically speaking, the economic downturn actually helps them because they move up in the pecking order of their income, which is fixed. And of course, if asset prices fall, it means they can pick up shares and houses more cheaply as well. So it's, plus I might add, they don't have to work as much either. So actually there's lots of plus side actually if you're in what one thinker, Joel Kotkin, calls the clerisy, that is this kind of bureaucratic class which the Labor Party basically now represents. It doesn't represent private sector workers anymore.
Well, and this was the thing that also, I remember talking about this many, many times on TV, about the education lockdowns. By shutting kids out of the schools, the one that the people that you were hurting the most were the kids who, in part of it, that's how they get breakfast, right? The guaranteed way of breakfast is to go to before school care, and also complete ignorance about the fact that there are still a couple of million Australians who have no internet connection. So it's all great if you're sitting there deciding, well, will I spend today in the cinema room or will I send the kids to the tutor? But if you're in the 1-2 bedroom unit that is just in an internet blackout zone, in an information desert, you got smashed by this, but seemingly no one cared.
No, look, that's a very good point. And that's why, for instance, Brazil's obviously going through a shocking time at the moment. There's so many deaths there and the case numbers are increasing. But the president of Brazil is being totally castigated as some sort of monster for not wanting to shut down the country as if it's an easy... It's a very poor country, Brazil. I've been to a favela before, and you cannot shut these things down. They're slums. You can't shut a slum down. People don't have houses. They don't have TVs. They don't have Wi-Fi. They can't work from home. So it's not an easy decision to force people to stay indoors in these very large, poor countries. Let's talk about India. They've had the biggest gross downgrade in the world just this week from the IMF. And it's partly, I think, because the government there, I think foolishly, tried to impose a very severe lockdown, which is killing, which is already killing people in and of itself. And actually, the virus so far, I mean, touch wood, hasn't really affected India kind of much at all compared to other countries in a per capita sense. And that may well be because the life expectancy is so low there. And as we now know, the disease tends to kill, people in their 80s.
Well, and this is the thing, right? So help me out about where either the world lost its bottle or got too scared or too nervous. Because, sadly, viruses exist, sadly, death exists, communicable diseases exist, people with comorbidity, all of this stuff has already existed. It's not like death was invented by this virus towards the end of last year.
You'd almost think it had been, actually, just, by the way the media has been carrying on about it. I agree with you. But
this is the thing. It feels like there is this confluence of events and world thinking and abdication of responsibility by governments to outsourcing bureaucracies or modelling that basically meant that we had this perfect storm of people who live in a global news environment going, look what's happening in China, look what's happening in Italy, to make sure we're not Northern Italy, rather than saying the problem is what's happening in Northern Italy. They smoke more, they're older population, the technology wasn't as good.
Well, look, that's right. The fact is, by mid-April, I think it was pretty clear that this virus was nowhere near as lethal as first thought. But governments had, of course, already kind of been talking about catastrophe. They'd attached themselves to that narrative, and it's very difficult to walk back from that. And you're still seeing them kind of talk about how incredibly serious this is, and but it's I think the public actually kind of now kind of cottoning on to the fact that. It's not as lethal as first thought. And just back to the death statistics, all we hear every day is how many people have died. And sure, it's sad. A lot of people have died, 480. But 60 million people die every year, and 3 million people die from respiratory infections. 3 million. So I think we just is in context that we're all going to die. We're all going to die of something. And the median age of death from this disease is generally above life expectancy.
Yeah, exactly. Adam, lovely to talk to you. And again, when everyone's losing their bottle about Victoria, when those state premiers sit down tomorrow at National Cabinet to find a way to push everything off for another month, 16 people in a country of 25 million are in hospital. 16 people, all right? So, yes, a dozen here, a dozen there, a couple of hundred cases, uptick, all settle down. 16. Not every case equals imminent death. All right, it's when it gets to hospitalisation that it becomes a problem. Adam, lovely to talk to you, mate. All the best.
Thanks very much, Paul.
Adam Creighton. That man is a rock star, and I tell you what, honestly, you've got to read his stuff every single day. Follow him on Twitter, read him in the paper. Very clever man.